Look at almost any major red carpet event today, and amid the flashbulbs and designer gowns, there's an invisible guest stealing the spotlight. A sudden wave of celebrity weight loss has completely flooded our social media feeds. The open secret behind this transformation comes in the form of injectable medications, like Ozempic, Wegovy, and Mounjaro. To the public, they are treated as a punchline, a cosmetic tool that dissolves unwanted pounds with the simple click of a dial. But this obsession with aesthetic perfection obscures what these drugs actually do. The focus on dropping dress sizes has masked a medical reality that is far more complex and far more critical. Beyond the cosmetic hype, the FDA recently issued a major label expansion for Ozempic. The drug is now officially approved to prevent chronic kidney disease from worsening into total organ failure requiring dialysis, and to reduce the risk of cardiovascular death in adults with type 2 diabetes. Even more surprising, emerging clinical data shows these exact same molecules are drastically reducing intoxication and overdose rates among people suffering from severe alcoholism and opioid addiction. So, how exactly does an injection originally designed to lower blood sugar in diabetics manage to shield major internal organs and simultaneously rewrite deep-seated addictive behaviors? The answer lies in a chemical hijack of the body's internal communication network. It starts in the digestive system. Every time we eat, our intestines release a naturally occurring hormone called GLP-1. This hormone has two main jobs. It tells the pancreas to release insulin, and it slows down the rate at which our stomach empties its contents. Medications like semaglutide are heavily engineered synthetic versions of this exact hormone. But while natural GLP-1 breaks down in minutes, these synthetic mimics are designed to multiply and linger in the gut for days. By flooding the system with these long-lasting mimics, the drugs drastically reduce gastric emptying. Food sits in the stomach much longer, sending a continuous signal to the body that it is comfortably, completely full. This extreme digestive slowdown is also the direct cause of the severe gastrointestinal distress many users report. When digestion grinds to a halt, it often leads to chronic nausea, vomiting, and severe constipation. The drug's highly sought-after ability to crush your appetite and its most unpleasant physical side effects are driven by the exact same biological mechanism. As the drug takes hold and causes rapid systemic weight loss, it quickly alters superficial appearances. This rapid fat depletion leads to what's been dubbed Ozempic face, a noticeable hollowing of the cheeks and a loss of skin-supporting collagen. While the internet fixates on these cosmetic changes, the true impact of losing that mass is happening out of sight. Stripping away that excess fat provides massive mechanical and chemical relief to the body's overtaxed cardiovascular and metabolic systems. This chart visualizes data from a massive clinical study called the FLOW trial, where researchers measured this internal relief precisely. They tracked adults with type 2 diabetes and chronic kidney disease, and found a 24% drop in the risk of their kidney disease worsening or ending in cardiovascular death. That risk reduction did not just happen over a few weeks. The data held up over a 3-year period, proving that this medication provides sustained defense against total organ failure. The sagging skin and hollowed cheeks going viral online are simply visible byproducts of a profound, life-extending rescue operation happening deep inside the torso. The most shocking discovery about these synthetic molecules is that they do not stay isolated in the bloodstream. Because they are engineered to be durable, they actually cross the blood-brain barrier and penetrate deep into neurological tissue. They make their way straight into the mesolimbic system. This specific region of the brain manages pleasure, reward, and impulse control, and it is heavily covered in GLP-1 receptors. Once inside, the drug binds to these receptors and acts as a neurological brake. They intercept the dopamine signals that normally flood the brain when we anticipate a reward, significantly slowing down that deeply ingrained feedback loop. Clinically, this mechanism silences food noise, the constant mental chatter about eating. Observational studies show that same chemical brake is now blunting the primal compulsive urges for alcohol, nicotine, and even opioids. These molecules have evolved into potent neurological modulators. They are physically rewiring human impulse control at its source. proving that a single treatment can govern both metabolic signaling and the fundamental pathways of human desire. GLP-1 receptor agonists have evolved from a narrow diabetes treatment into some of the most broadly indicated and highly sought-after pharmaceuticals in modern medicine. Yet this clinical triumph is currently colliding with an unregulated social media craze. Perfectly healthy individuals, lacking any metabolic disease, are obtaining the drug strictly for rapid cosmetic weight loss. This off-label use carries severe hidden risks. Without an underlying metabolic condition, these users lack the physiological buffers needed to handle the drug, leaving them highly vulnerable to serious adverse events like acute pancreatitis and gallbladder disease. This cosmetic gold rush has triggered a massive ethical crisis. The sudden surge in off-label demand has completely crippled the global supply chain for these medications. As a direct result, actual patients with type 2 diabetes and chronic kidney disease, people who desperately rely on these exact injections to prevent organ failure, are losing access to their life-saving medication. Semaglutide is a brilliant scientific achievement that successfully rewires the gut, protects vital organs, and calms the addicted brain. But treating a highly engineered metabolic modulator like a cosmetic toy is a deeply dangerous game, and it comes with very real human costs.